Mental health. One thing I've learned throughout my life, and especially recently, is mental health is part of overall health. Our children and our youth need to be healthy enough to learn, and our teachers and school staff need to be healthy enough and versatile enough to reach and teach each of their students. Hello, my name is Shashank Joshi, and I'm a professor of psychiatry, pediatrics, and education at the Stanford School of Medicine. I'm also the director of school mental health services for Lucile Packard Children's Hospital and the assistant vice provost for academic well-being at Stanford University. As a pediatrician and child and adolescent psychiatrist, I have learned this from firsthand experience, not only as a faculty member at Stanford University over the past 25 years, but also as a parent. So I come to this work from many different angles. And what I'm about to tell you is not something I hope any of you have to deal with, but I know many of you already have. We have raised 3 boys together, my wife and I, and we went through this experience as parents because one of our kids really struggled, and he struggled with severe depression and anxiety. He made a suicide attempt several years ago, and we got through it. We got through it because we had a team and we had a school that really understood what his needs were. But it was very hard. It was hard to find the doctors, the therapists, and as many of you know, it can feel impossible when you're beginning this journey. But if it was hard for me, I can only imagine how hard it is for the community at large. We've been in this community for 25 years. We are very well connected. We are very privileged. We have resources. And yet, it was still next to impossible to find a community-based therapist and team that could see my son in a rapid period of time. So we relied on the school. And we were blessed to find a school-based mental health therapist and team who really got my kid and who he felt safe opening up to, and started in middle school, and really in high school is when it was most important and where it's continued to be so crucial, not only for his mental health and well-being, but for his overall academic engagement. And he's not alone. 75% of American youth who receive mental health care get support in schools. We have almost 70 million children and teens attending public school every day in the U.S. 25% of those kids are immigrants or children of immigrants. And so with an ever diversifying youth population, we have to make sure that we have clinicians and school support who really understand the children from their particular experience and who know how to hold space for people who are often different from themselves, but who are very versatile in reaching and teaching each of the students that come to them. And so in this work that I've done in suicide prevention in the past 10 years, prior to our son struggling, as a community, as a set of communities in Northern California, we had several tragic losses, several suicide clusters throughout the state of California, but within our school districts here in San Mateo and Santa Clara County, we learned that when a community has a profound loss, people will come together. Agencies will come to the table. And the most important lessons we learned from the clusters we've had in the last 10 years is communities have learned how to turn their grief into positive action. And in 2009, when we began to experience a cluster here in the northern part of Santa Clara County, in collaboration with several of my colleagues at Stanford and throughout the community in primary care and in schools, we created the K12 Toolkit for mental health promotion and suicide prevention. And we began in 2009 with people just coming to the table saying, what can we do? How do we help? We are a lot of cooks in the kitchen, and we need to find a place where we can convene best practices so that we don't have to spend time looking for, say, a crisis intervention protocol if we're worried about a student, or the messaging that has to go out if there is a death by suicide, or as a school district, we are really wanting to prevent a cluster in our community. What do we do for prevention? So in 2013, this toolkit was published on the web, and it was a 160-page PDF that a lot of people downloaded. People have continued to download it. We have a number of hits that come to our website, and what we want to do is, in a one-stop place, allow for people to access best practices in mental health promotion from K through 12, crisis intervention, and postvention when there is a loss. So we expanded the toolkit to answer another frequent parent and educator question. What happens after high school? And this is a very important question because it's vital that we really understand the needs of transition age youth, those young adults who are emerging between 18 and 25. So we in fact put in transition sections for the youth lifespan, starting from elementary to middle school transitions, to middle to high school, and now building in what are some tools that are out there that parents and students can use as they navigate the next steps after high school. Particularly for those who have had some mental health struggles, how do they launch and land in a way that is as predictable as it can be in an unpredictable environment? The secondary aim is to make sure that we highlight what are the research best practices where research exists in order to not only provide some facts, but also dispel some myths. For example, talking about suicide does not increase the risk of suicide. And there's an asterisk with that statement. How we talk about suicide is just as important as whether or not we open the topic for discussion. As many of you know or may not know, in California, we have a set of laws that require that in public schools, we talk about well-being promotion and suicide prevention. We teach our youth about what mental health is, why it's important for everyone, how to help someone who might need some extra support, how to get help for themselves in a crisis, and how to get help for a friend who might be at risk for suicide. And so we have spent a lot of time with this toolkit, and now we are wanting to scale this to a level where more people can access it. Because it's on the internet, we've had several constituents from around the world reach out to us, notably Tecnológico de Monterrey, which is in Monterrey, Mexico. It's the largest private university network in Central and South America. They unfortunately had a number of deaths by suicide in their high school preparatory academies, as well as at the college level. They used our toolkit to help them develop their own set of resources. I went down there and consulted with them, and we actually formed a partnership with Stanford and Tec de Monterrey. We had some tragedies in South Asia and Pakistan, and we were able to go there and do training with their school mental health personnel. And so part of the reason for something like this is we'll never be able to have enough clinicians to reach every student on a one-to-one basis, but what we can do is build capacity. And so the opportunity now is that I envision this virtual toolkit, which currently lives online, turning into a free, easy-to-navigate app. The website works for now, but isn't convenient when someone is in a crisis and needs a tool and all they have is their phone. We know that smartphones are in every corner of the globe, from the smallest villages to the largest cities, and this is how I get my information. I am typically going to my phone. And so this is what we'd like to do now with an already known resource. And I'd like to take what's already been done, where our website and our toolkit is highlighted on national websites like SAMHSA and state websites like the California Department of Education, where our toolkit has been featured as part of the model suicide prevention policy, for example, for the state of California. And to do that well, to turn this into an app, to really scale this, we're going to need some more support. Support that provides time for ideation and design, tech support, help with marketing the app to new communities. And I know that given the extraordinary resources we've already been given as seed money from the Packard Foundation, from the Children's Hospital, from local philanthropies, together, I think we can scale this idea that mental health is part of overall health, and that our children and youth have to be healthy enough to learn, and that our teachers and school staff have to be healthy enough and versatile enough to reach and teach every student. Thank you so much for your attention.